For children that are in foster care who come from a background of maybe not having enough food to eat, or maybe sporadic or erratic eating times, a lot of the feeding issues really are about comfort and security. Children in foster care have what's called an invisible suitcase. In other words, it's the things that they bring with them from their past, and they bring it to them, or they bring it with them to every part of their lives, and they carry around this baggage. And one of the things that they carry around is the thought that I'm powerless and you can't help me, or you're unreliable. And when you have that sort of invisible suitcase that you have with you, that can bring forth issues during meal times. And about food hoarding and gorging food. Those are actually, when you think about someone who's had a history of food insecurity, normal reactions to that situation. In other words, hoarding, some people think of hoarding as stealing, and it's really not stealing per se, as a survival technique that had helped in the past. But of course now, when they're in a home and food is available, it can become an issue. Gorging is another one of these survival strategies. Eat as much as you can, as quickly as you can, before the food is gone or before someone else gets your food. Another thing too is children who've been in situations with food insecurity may not have a good sense of satiety, or when they've had enough. And so that can lead children to overeat at meals and at snacks. Some things you can do around the home, in the kitchen, you can almost make a little bit of a show of it, of making food visible. Letting children know, see, you don't need to worry. See, there's plenty of food. Instead of stocking your cupboards, maybe for a while overstock your cupboards. One example is, let's say there's a particular cereal that the child really likes. Then instead of having one box of that cereal before they eat breakfast, you can show them, look, we have 3 boxes of your favorite cereal. It's okay, you don't need to eat it all right now. There will be plenty. Along with that, when you're cooking a meal, you may overcook a little bit and have leftovers, and that allows the children to see that not only is there food, but there will be enough food for another time. And then for children, you can also offer them their own stash of food. So area in the refrigerator, or a drawer, or somewhere where they can say it's a drawer, and they can keep some of their favorite foods, some granola bars, or in the refrigerator some carrots or something like that that they enjoy, so that they know that there is food there is food available. When children first come to your home, one way to help with food insecurity is to provide frequent snacks. And when I say frequent snacks, it may be every hour is snack time for a while for that child, until they learn that there is food here. I'm not going to run out of food. I'm not going to go hungry. Children may not have a good sense of satiety or when they feel full, so you may want to add some fat to their snacks. So crackers with a little bit of peanut butter, or cheese sticks, or something that has some fat and protein to help them feel filled up. When a child goes for visitation with their parents, you can provide a snack for them at that time, so that they have something that can go with them. As well as for some children, it may be comforting to carry a little bit of food around with them. So for example, a granola bar that they can have with them, almost like a security blanket type of feeling. Now, when I talk about frequent feedings, frequent snacks, one thing I don't recommend is allowing children to graze all day. In other words, just leaving food out, and the child just goes around and just eats whatever they can grab their hands on. The reason I don't recommend grazing is that what is being set up, although well-intentioned, is you're telling the child, okay, here's the food, but it's up to you. You're going to have to fend for yourself. You're going to have to find the food. You're going to have to get the food. A lot of these feeding issues revolve around trust and being able to trust. It's that invisible suitcase that children carry with them into your home saying that I don't feel you can be trusted. So allowing plenty of feeding opportunities, letting the child know I will feed you, I will take care of you. So hourly snacks allows the child to start forming that attachment, to start having some of that security that you're going to provide for them. And meal times can definitely be a challenge when it comes to food issues in children. And that's one thing we hear about the most in our clinic is issues around meal times. And for children that are arriving into foster homes that maybe have had an erratic schedule, a full family at the meal, sitting, eating, passing around food, talking, laughing, things that most of us find are reassuring may be overwhelming for that child. That child may be used to eating in isolation and maybe has not had the social benefits of family meals that many of us are able to enjoy. So there are some things you can do with that. One is I recommend some form of family ritual. For some families, it may be saying a prayer. For some families, it may be lighting a candle. For some families, it may be going around the room and talking about what you're thankful for that day or what made you happy that day. Now, if you do something like the last one, where you go around the room and everyone says something, I do recommend allowing children to have a pass, because if they're feeling overwhelmed, that may be too much for them. But have some sort of ritual where each day the child will learn that when they sit down, this is what we do, and then we eat, and then we do this, and that sort of security around the ritual. I'm a big believer, and I teach a lot of division of responsibility to families. It's from the Ellen Satter Institute. Ellen Satter is a dietitian as well as a family counselor, and she has written many books on feeding in children, and she often talks about the division of responsibility. Now, how that works is it puts the responsibility of nutrition onto both the parent and to the child. So the parent or the foster parent or the adult, the caretaker in the home, is responsible for deciding when a child eats, where a child eats, and what foods are provided to that child. It's the child's responsibility to determine what, if anything, they're going to eat and how much they eat. And the nice thing about the division of responsibility is once you have put out a nutritious variety of healthy foods, your job is done. And there's no reason to argue over how many green beans a child ate or if they, should take 3 more bites of chicken. It gets rid of all of that and allows children to use their natural hunger cues. Now, some caveats to that for children in foster care. One is their hunger cues may not, or their satiety cues, their feeling of being full, may not be working quite right. So they may gorge themselves and overeat. Another thing to remember too is they may not be used to foods that you are cooking and preparing in your home. So I recommend either asking the child, what sorts of foods do you like to eat? And if they like mac and cheese, or if they like bread and butter, or if they like peanut butter sandwiches, then it's okay to have that at the table as part of the options. Also, I recommend family-style meals where the food gets passed around and everyone's able to take whichever they like of the foods and how much that they like. Now, a child, especially a lot of young children, may fill up their plate and not want to eat it, or they may ask for seconds, and that's okay. But giving the child that ability to pick out the foods that they like. And if your foster child just likes mac and cheese, that's okay. They'll get there. Don't worry about, if they're only eating 2 green beans or they won't eat the green beans. They'll be fine. Just let them pick out the foods that they want to eat and the amounts that they want to eat. Now, one tip is if you do have a child that is gorging, what you can do is plan ahead and have a waste bin or something nearby and teach the child that if they start feeling sick, this is a place that they can go and not make a mess at the dinner table. Finally, a few things to remember when it comes to feeding and foster children is please do not ever use food or taking away food as a punishment. Again, these are children who, if they're having feeding issues, most likely came from some form of food insecurity, and any lessons that you're trying to teach by taking away the food really aren't going to be learned. You're going to just be upsetting the child even more. I also recommend, again, the division of responsibility, which gets away from the idea of the clean plate club, or you have to finish everything on your plate. If a child doesn't eat everything on their plate and there's quite a bit there and you don't want to waste food, you can certainly put some saran wrap over it, stick it in the refrigerator, and then when the child's hungry later for a snack, you can heat up the food and bring it back and they can eat it then. It's a good idea to consider giving a child a multivitamin each day, a vitamin gummy or something equivalent to that as they are getting their nutrition status back up. And remember that when it comes to these feeding issues, really what we're talking about is behavior and a sense of security. And these are some tough issues, and these are not overnight fix issues by any stretch of the imagination. So it requires a lot of patience, and remembering that really for many issues in children, behaviors are going to get worse before they get better. And for feeding issues, it's probably going to take time, if not weeks, if not months, if not maybe even years. And a final note is when you're helping these children and taking care of these children, to remember to help and take care of yourself as well. And opportunities such as respite care or reaching out to your community for some support to help you take care of these children.